Good morning, Chicago. I'm Dr. Allison Already, Commissioner at the Chicago Department of Public Health. It is Thursday, April 1st. Happy April Fool's Day. And happy spring weather, except not today. It's really in the 30s today. But certainly we are moving into spring, and with that we are seeing a lot more people out and about. And in that context, we are seeing some concerning increases in our COVID numbers. On the plus side, we are making really good progress in vaccines. So as always, we're going to take your questions. You can put them directly into the box below on Twitter or Facebook. You can also use the hashtag AskDrArwady, and we'll be taking your questions live. We will start with a quick look at our data. So chicago.gov/coronavirus remains your one-stop shop for everything related to COVID in Chicago. And you can get to the dashboard directly by going to chi.gov/COVID-. And if we We are now averaging 519 cases, new COVID diagnoses every day. That's up 41% just from a week ago. We were at 367, and it is still increasing. We can tell, because data comes in, there's a little bit of a lag on when data comes in. We're always reporting back a couple of days, and we can see that the numbers are continuing to rise without any sign of decrease at this point. Our positivity is similarly up to 4.6%. Just a week ago, we were at 3.4%. So below the 5% cutoff still, but heading the wrong way. And the concern has been in cases, in emergency department visits, in positivity, they all are increasing at more than 15% week upon week, which puts us into this really highest risk category in terms of the growth in cases. I do want to highlight a couple of things that we are seeing that are different from what we've seen previously. So if we go to the demographics page, and remember you can explore this yourself, if we just look at, let's say, the last month or so, here's what our rate increase looks like. And if we look by age, just click here, you can see right up on top here in red, I'll blow it up. In red are our 18 to 29-year-olds, very, very disproportionately driving COVID cases, followed in light blue, 30 to 39-year-olds, followed in yellow, 40 to 49-year-olds, and it just marches all the way down. The good news is down at the bottom here. These gray and pink, that's our new case rates in people in their 70s and 80s. And you can see, at least at this point, it's remained very flat. And if there's a group I want to stay flat, it's that oldest, highest risk group. Some of that is because we've gotten a lot of vaccination done in that group. Some is because I think that group is probably being the most cautious. But as a reminder, if there are people, especially in this 18 to 40 group, please, please, lots of caution if you're going to be seeing anybody in the older group or anybody with underlying conditions. I am very aware that this weekend is Easter. I know it's also time for Passover. I know that this is spring and gathering, and it's a time when a lot of people traditionally get together. But the virus does not know that it's Easter. It does not know that it is Passover. And the things that we've been doing to protect each other and protect those we care about, especially now with vaccine in the mix, become even more important. If there are people in your circle who are not fully vaccinated 2 weeks post that second dose of vaccine, or if they're at really high risk for COVID, if you've got children who haven't been able to get vaccinated yet, especially if they're at increased risk, you want to be really careful. Even with gathering around something like Easter, we're not at a point to be having those large gatherings yet. Unless you've got a fully vaccinated group. And I know just based on our numbers, we're not that fully vaccinated yet, although the news is looking good there. The other things on this is that if you look by race ethnicity, just to kind of highlight what that looks like, and let me just select the major groups. So this really, if you look, these are the 4 major race ethnicity groups in Chicago. Red are white non-Latinx folks, blue are Latinx, purple are black non-Latinx, and green are Asian non-Latinx. You can see just over these last couple of weeks, increases across all groups, but being driven especially by white non-Latinx Chicagoans. And that is really a different pattern than we have seen here throughout the COVID outbreak. We've done a lot of very focused vaccination efforts, particularly in Latinx Chicagoans who had been disproportionately impacted from a case standpoint for weeks here. And I do just want to highlight that it's, in a lot of ways this is looking more like what Chicago looks like, but some newer demographics there. And if we look at cases in last week, for example, where we saw the most newly diagnosed cases of COVID were right here in 60614 and 60657. You can see the positivities here were in the 6 to 7% range. And the north side historically has not been the major site of where we've seen a lot of new COVID cases. And you compare this to some of the areas that have historically been our hot spots, 60639 for weeks and weeks, that positivity is below, those case numbers are below, and similarly 60629, that positivity is below, those cases are below. And our team has been doing a lot of looking at this, right? What is driving this? And it's multifactorial, but one is certainly variants. And I want to be very clear that we are absolutely detecting more variants here in Chicago, particularly that B117, which is the one that originally emerged in the UK. That one is more infectious. It's sort of more contagious, if you will. And so where people are letting down their guard a little bit and maybe not wearing the mask or doing more gathering, not staying home if they're a little bit sick, some of these things, even in people who are younger, we are seeing more of the spread of that variant. And we're seeing a little more of it, on the north side as well. And so variants are certainly a piece of this. Just a reminder, the vaccines that we have are protective against all of the variants that we have, but the protectivity goes down just a little bit, particularly with not the B117 so much, but a couple of the others. So the vaccines remain very protective, but one of the main reasons to get folks vaccinated is that where we're averaging more than 500 cases a day, every one of those opportunities, every new case is an opportunity for a variant to spread or a variant to emerge. So variants are a piece of this. But even more than that, our case investigators are finding that contact, we do this contact tracing whenever where there's been a case, and there's something called the contact index, which is basically how many contacts does someone with COVID report. And a contact is people, again, you've been 15 minutes without a mask in close contact. And throughout most of this outbreak, we were not getting a lot of contacts. People were reporting, contact index of just a couple of people, usually folks in the home. And just over this last month or so, the contact index, the number of contacts that people are reporting is way up because people are doing more high-risk gathering. And that's happening both in private homes to an extent. It's happening in public settings. People are gathering with friends, with family. Sometimes that's in bars and restaurants. Sometimes that's in other settings. We've seen a number of outbreaks associated with sporting events. You've heard us talking about this, but just emphasizing that's the difference. The other thing where we look at the data is that we don't track anybody's individual cell phone data, but we look at cell phone movement patterns across the city and how those change, how they compare to where we were last year. We even look at during times in the day. And we are still seeing more Chicagoans staying home, particularly during the daytime, more people still working from home. But what we've seen just over these last few weeks is in those evening hours, many, many more people out and about and moving around. And I think this just reflects that people are excited for the warm weather, feeling good about vaccine, and I think just sort of wishing that COVID was over. But we're looking at Michigan with real concern. Their surge is now almost as big in this third surge. They're about 2/3 as high as they saw in the second surge. And we are on a similar trajectory here. They are also seeing increases in their hospitalizations. And, if you're interested, I know we've been getting some questions about that. Just as a reminder, if we go back onto the screen here, you can look at things like hospital capacity here and actually get a sense of what some of that has looked like over time. And we're just, we still have a low number of people in the hospital compared to what we saw later. But you can see, like, these are our non-ICU beds, flattened out and just coming up a little bit. And that's similar to what we're seeing across the state. And the question is going to be, with vaccine in the mix, if we can get a lot of the highest risk folks vaccinated quickly, will we see the impact on these severe outcomes? I don't have the major concern for a huge number of deaths or overwhelming the healthcare system based on where we are right now, but the increase in cases really has the potential to, to cause significant illness, hospitalizations, and potentially some increase in death again. So it's why we've not been able to make further reopening on the indoor side. Outdoor is best, and I would just ask, if you're going to be getting together with folks at Easter, have a really serious conversation about vaccination status, and if you have folks who are at risk, it's not the year yet. Normally, I know it's hard, second year in a row, right? I would normally be gathering with a lot of my extended family, big dinner, the whole thing. And although some of my family is now vaccinated, we are not widely vaccinated, and it's just not a time yet to be doing those big gatherings. Let me also just show you here the vaccination data. You can explore this yourself, but this data at a glance, you can take a quick look and get a sense of actually sort of how vaccinated are we. And you can see that, if we look at just Chicago residents who are over 18, more than a third of Chicagoans have now gotten at least that first dose, but we're still at less than 1 in 5, 18.6% have completed it. And remember, you got to be 2 weeks post to have completed it. So more than 80% of Chicagoans have not completed their vaccine series, even the adults. And we're making progress on the 65-plussers. We're up to 57%. That is still not where it needs to be. I'm anxious about this. If you've got opportunities, if you're talking to folks, making plans, anybody over 65, please have that conversation with them. As we move ahead some more here, we're going to keep that focus on folks over 65. We've asked providers, pharmacists, our own pods, want to get people in, and I think you're going to be hearing some more about opportunities to bring a senior and get vaccinated as some more vaccine supply comes in. The last thing I'll show you, because we are getting a lot of questions about vaccine sort of supply, this vaccination data is where you can look in a lot of detail, but vaccine allocation points to really how much vaccine has Chicago received by manufacturer and dose. And so what you see is, if you look down, we're 16 weeks into vaccinating, so 4 months, and we've gotten a total of 753,000 first doses. And what you see is that this week, we've got a real increase for the first time, kind of looking ahead, in our Johnson & Johnson vaccine. So you see, and sorry if you can't see the top here, the left is Pfizer, the middle is Moderna, and this is Janssen. And the second doses we sort of take for granted. We do all of that work of getting those people vaccinated, but second doses don't allow you to expand vaccination. So really the first doses are where we're able to expand. And you can see, this week we're getting about 37,000 doses of Pfizer, about 27,000 doses of Moderna, and then we're getting almost 40,000 doses of Pfizer, of Johnson & Johnson, looking ahead really into next week. And that's a big increase. It's by far the most we'd gotten. You can see we got 22,000 back in week 12, then we didn't get any, then just 6,000, and then 15, and then 40. And we've got big plans for that Johnson & Johnson. We're using it to expand the homebound program. We're using it to bring to more manufacturing settings. We're using it to vaccinate everybody who works at O'Hare. We're using it to vaccinate some of the union workers that we're very focused on. We've got plans to be vaccinating restaurant and food service workers in dedicated events. And we wanted to get it to providers. We want to use it at some of the mass vaccination sites, like at Chicago State. And this Johnson & Johnson is really what we're counting on. So there's been a little bit of stuff in the news. We'll see if there's some questions there. So let's go ahead and turn to your questions. And Ken Ballard, maybe we'll start with on Facebook. Why is there a shortage of vaccines in Chicago and a surplus downstate? And Alexandra Montez on Facebook, when is Chicago going to receive more vaccine doses? So let's take both of those together. So Chicago is allocated vaccine based on population, and broadly that is how vaccine is allocated across the whole U.S. The large cities often receive vaccine allocation directly, like Chicago does and New York does and some others do. And then Illinois is also allocated based on population. The state makes decisions about where to distribute vaccine across the state. And, we've been in a lot of conversations with the state to please work on pushing additional vaccine up to the Northeast, which is the most heavily populated area. I'm really pleased that there are parts of the state that there's plenty of vaccine available, but that is also really, the goal then is to push some of those additional doses up here, because it's not just Chicago where we see such high demand, but across Cook and Lake and, really the Northeast there. And so, we've asked the state, for example, where we are vaccinating those 60,000 employees who work at O'Hare. Most of those are not Chicago residents, and we've said, let's partner on that. Let's put in some of that state vaccine and help support some of those essential worker groups. We've said, let's share vaccine opportunities, particularly where we're vaccinating a lot of non-Chicago residents. And I'm hopeful that as vaccine supply increases, the best practice always is to push vaccine where the need is greatest. That's what we do here in Chicago, and I know that's what they certainly are planning across the state. So I am very optimistic that we will see more and more vaccine pushed to this area broadly. Still, cities, not just Chicago, but like all of the large cities, they're big employment centers. And so much of our vaccinating has been through employment and through essential workers. And that's been good. That's been good from an equity standpoint. It's been good in terms of getting folks who don't have the luxury of working from home, particularly in settings where they're not always able to keep distance. And it's been really important for us controlling COVID in these settings. But it also means that we have vaccinated a lot, we're now between 30 and 35%, about 1 in 3 of all of the vaccine that comes to Chicago has gone to non-Chicago residents. And we haven't kept up in terms of Chicago residents getting vaccinated outside. So I wouldn't change again anything that we did related to getting those essential workers vaccinated, but we do need additional vaccine up here, definitely. And I think the concern, and to Alexandra's question, when are we going to receive more vaccine doses? I mean, this is what we push on every single week. We could be handling 2, 3, 4 times the amount of vaccine we are getting, no problem. We have more than 600 vaccine providers enrolled, and every week we can only give about 1/3 of them vaccine. There are lots of providers who still have never been able to get vaccine, and the importance is for those providers, the Pfizer remains a little bit complicated in terms of it's got this ultra cold vaccination storage. You only have 5 days to use it from when you pull it out. There's a lot more related to mixing that vaccine. You have to use saline. It's generally done by pharmacists or people with more training. It's not an ideal setting for an outpatient setting. And so Moderna has really been the one vaccine that's been useful for all of these outpatient settings, which from my standpoint is really where the money is in terms of getting vaccine to, into neighborhoods, to smaller providers. And Johnson & Johnson now coming in only has to be refrigerated is important there. The worry is that, and I see some question about this here, Donna Cameron on Facebook is asking, with the mix-up of the J&J vaccine where they had to throw out 15 million vaccines, will that slow down or push back Illinois or Chicago from getting more J&J vaccines? I think it probably will, in the short term, not in the long term. On the one hand, we're still waiting to hear the details on what that is going to look like, but I am concerned about it because the Johnson & Johnson vaccine is very much the vaccine that we have been hearing the signal on to be the major increase, especially over these next couple of weeks. And this is why the FDA has good oversight. I mean, this is exactly why we check. There were, and in case folks didn't hear about this, there's a very large plant in Baltimore that was making both the Johnson & Johnson vaccine and the AstraZeneca vaccine. The AstraZeneca vaccine not yet approved for use here in the US, but production is underway just as it has been all along. And there was some some issue where some mixing was done. I don't know all the details of it, but there were, yes, potentially 15 million doses that we were expecting to sort of ship out, and 15 million is a lot. I mean, that's multiple weeks of vaccine supply with the rate that vaccine is being produced right now. And so we know that 40,000 doses that we're getting for Chicago this coming week, we expect to be getting that as planned. But I am concerned that potentially, for the next couple of weeks, we may get very little. I don't know yet, and this has been part of the problem, that we don't know more than a week ahead how much vaccine we're getting. We had heard that there would be sort of more growth there and more consistency, but when there are issues like this, and for a flu vaccine, this isn't a huge deal if something like this happens, because you throw things off 2 weeks, 3 weeks, it's not a big deal. But for this, where really every week matters, I am concerned. So we're asking questions. We'll share more as we have it, but we continue to use, to this efficiency point. Why are we slow? We are not slow here in Chicago. Honestly, we are, every week since the very first week of vaccination, every single week, we have hit our goal to get 95% of our vaccine out, whether that's to providers, whether that's to appointments. And we set this goal that within 7 days, at least 85% of our vaccine would be in arms and reported. That's a really ambitious goal from an efficiency standpoint, but we look to it for our providers. We use it within all of our own planning. And we've been meeting and far exceeding that goal. Last week, we were at 94% of our vaccine was in arms and reported within a week, and that's really efficient. Like, just to kind of put that in some context, if you look at this nationally, most states in terms of getting vaccine into arms are in the 70 to 80% range of being able to do that in a week, and we're consistently hitting 94, 95, 96% even. So we're getting vaccine into arms just as soon as it gets here, but it really is that supply that's been holding us back. There's some good news potentially, and I see some other questions about other kind of other vaccine types where we are hoping that fairly soon, I'm hoping maybe the end of this month, Moderna may be able to start putting 15 doses instead of 10 doses into their vials. That would increase that capacity by about 50%, which would be huge. We don't have an exact timeline, but that's one of the things we're watching for, that again, I think is about a month away. The AstraZeneca vaccine, I do think fairly soon here, we're going to see it get put forward for consideration for emergency use authorization, which would be another entire vaccine. The Novavax vaccine, a little farther behind, but the data on that looks good. That looks like November, and I mean, not November, it looks like May. And then the Pfizer vaccine will hopefully also continue to see some more increases there, but it is just supply. So Kim Garrity on Facebook, are we pushing vaccines to the north side areas you spoke about and opening the age range? Yes. So there's a number of things that are happening in 1C. And 1C is, the focus of 1A was about healthcare, right? The people who work in healthcare and the people who live in long-term care. 1B was about using that very limited vaccine at the beginning to focus on our hardest hit and highest risk areas. So whether those are the communities through Protect Chicago Plus, whether those are the highest risk frontline essential workers, or whether those are folks over 65. As we move into 1C, we're just about through those Protect Chicago. That was sort of the plan, and we're looking at where do we have under-vaccinated areas, and then where do we need to do additional work on outreach and on control, and these go together. But so yes, there is vaccine going to the north side. People probably heard we're opening 2 mass vaccination sites next week. One is at Wrigley Field, really with a focus on the north side, and the other is at Chicago State University with a focus on the far south side. We're continuing, there's more that's coming. There's additional things that are happening with some of the faith groups that you're going to hear more about. A lot of exciting things happening. Again, trying to reach seniors, trying to reach people who may not otherwise access vaccine. So more to come there. A lot more with different types of employers. And this question about opening the age range, we're definitely looking at it. I think I want to make sure people understand that if you look at the state data, actually, the part of the state that is having the biggest surge right now in COVID cases is actually right around the Peoria area. And that actually is the most vaccinated area of the state. So just having a lot of vaccine when still your population is less than 50% vaccinated is not fully protective. But I would definitely like to be making vaccine available, especially where we're seeing it in this younger age group. So as we learn a little bit more about supply, especially with this J&J, yeah, I'm feeling like we probably will open this age range up. But we just need to know a little more about what's happening with supply there. But the main thing is that even if we open up vaccine, remember, it takes, say you're getting, your Pfizer, your J&J, you're talking 6 weeks from that first dose before somebody's fully vaccinated. And so it really is, it's the next 4 to 6 to 8 weeks that are the point of major concern here. And I'm feeling very good about the summer, but that's the issue. Mary Haight from Facebook. What is the status on in-home vaccination? There seems to be no timeline, so people waiting are at a loss to understand they have to wait. It's scary given the variant cases rising. Is there a zip code or other plan to refer to? Okay, so I have actually good news on this. So one is that the team, our call center calls down the people who have registered for that in-home vaccination. And actually, we're finding about half of them have already managed to get vaccinated. So that's a good sign. And where there are people, again, as a reminder, who have other options to get vaccinated, please use those other options because they are generally going to be fastest. But we've been really pleased with the way that that's been going. It is very resource intensive, but we think it's important. And so we are increasing the size of that program. We are bringing in volunteers from what's called our Medical Reserve Corps. If there are people out there, doctors, nurses, others who are licensed to vaccinate, as a reminder on the website, you could sign up for the Medical Reserve Corps. There's a background check and some other information. But we're pairing up people from the Medical Reserve Corps with Chicago Fire Department folks. And we're actually just renting a bunch of cars and doing a bunch of things to get more transportation to be able to have 25 of those teams out at a time, which should increase quite a bit our ability to do hundreds of these a day. To really try to get through them in this April-May timeframe. So that's the hope. As a reminder, on the website, if you know somebody who is truly homebound, can't leave, do get them to sign up for that site. But it is a very manual calling on an individual basis. We set a specific time. We want to make sure that people know when the team is coming, so they let people in. People obviously are coming with identification, and there's some just safety things there. And yeah, so we are increasing some more of that. The teams are also really busy doing second doses. So as a reminder, almost everybody, not on the homebound, which is J&J, but through all of our senior week and our senior events and all of that, those teams are largely doing those second doses. Even at the United Center, we're on to doing a lot of second doses, even though we continue to do first doses through the drive up. And as we get through, big bulk of second doses, that's when you're able to kind of move some of those mobile teams and do even more. So there's more there. Patty Graff on Facebook. Can you elaborate on breakthrough infections after total vaccination? Yes. So for folks who don't know what Patty's referring to, we track whenever we have examples of COVID cases when someone is fully vaccinated, 2 weeks post their second dose or their single dose if they have J&J. It's rare. We've had fewer than 100 cases, but we have had cases here in Chicago of people who have been fully vaccinated. The good news, a couple good things on this. One is most of those people are asymptomatic, and they get picked up because we continue to do a lot of routine testing in high-risk settings, in long-term care facilities, in hospital settings, et cetera. And nobody's needed to be hospitalized. Nobody's died. But even a fantastic vaccine like this one, 95% effective. And actually a good news on this was that in the real world data, the Pfizer vaccine also was about 90% protective, even where they were swabbing and looking for mild infection. There had been some question, it's a little bit of a detour, but I think it's interesting. There had been some question because the Pfizer trials were the earliest, and they got started before we had as many variants, there had been some questions about, as more and more variants emerge, will these vaccines remain just as protective? And in fact, this real world study showing that they remain 90% protective even against the mild and the asymptomatic COVID is really, really good news. But even a vaccine that's 95% protective is not 100% protective. And so that's where, some of the guidance around, if you are out in public, to continue to wear the mask really comes through. So the good news is, in the long-term care facilities, for example, we've not had a single hospitalization or a single death in anybody who has been vaccinated, like in that highest risk setting. Really good to see. Mostly where we see cases are people who declined vaccination. So the vaccine's really working just like it should. And I don't want to give the impression this is a common thing. 100 cases out of the hundreds of thousands here in Chicago is not a lot, but we do have a small number. Rachel Robinson from Facebook, how are you handling the problem of people from different states getting vaccines here in Chicago? So as we've moved really into 1C on Monday, we did tighten up quite a bit the requirement that right now at City of Chicago sites, so if it's any of our mass vaccination sites, our pod sites, you need to be a Chicago resident right now, because we've got to get Chicago a little bit caught up here. Again, it's not an efficiency, it's just that we've been vaccinating a lot of non-Chicago residents. Where we are going to workplace settings, no problem, we'll vaccinate everybody who's there, but in terms of people signing up, we are limiting that, at least in the short term here. Laura Catherine from Facebook, is Loretto Hospital allowed to give the second dose? I got mine at Loretto and then vaccinations were stopped there. I am due tomorrow. Yes, Loretto is giving second doses. So you absolutely should be able to get your second dose on time. Give them a call if you have a question, but that has not changed, and you should be able to get your second dose on time. Okay. Susan Villanova on Facebook, are these vaccines now reconfiguring to be effective against the other strains like South Africa? All right, so all three of the currently approved or currently authorized vaccines in the US are all effective against all of the strains, including the strain that first emerged in South Africa. It's just that you drop from very high efficacy to a somewhat lower efficacy, but they all remain effective, and it's important for people to hear that. Getting vaccinated now is your absolute best protection against any of these strains. There is a lot of work happening behind the scenes. The scientists have been working. If we get to a point where there is another variant that emerges that these vaccines are not protective against, making sure the technology is there to be able to more quickly develop a booster dose if needed. But at this point, there is not a booster dose that is recommended. And the data from Pfizer showing not only that 90% real world efficacy, but just today there was data that came out showing that the duration of protection is good, that the people who were in the trial, they now have 6 months of follow-up data, and their immune protection remains fantastic. No sign that the vaccine is wearing off. The antibody levels remain high. All of the, they check for that. And because of that, that means that Pfizer is now going to be able to apply for the FDA for the full approval. It's been under emergency use authorization, but that step is the part that lets you actually move ahead and apply for the full approval authorization, which is a big deal and exciting. So all the vaccine news, really, except for that J&J manufacturing, remains good. And I'm pleased about this. Okay. At 4PinkWallsack from Twitter, as soon as people across the United States get vaccinated, then will the pandemic end? $1 million question. I like this question because you didn't put a number on it. Sometimes people try to say, as soon as 50% will we be done? As soon as 70% will we be done? The goal here is to get to a point where the virus does not have a lot of opportunity to spread widely. That is what, so-called herd immunity really means. There's not a magic number that we hit that says, okay, we're done. But the way we are going to get out of this pandemic is through vaccination. We are not going to eradicate COVID, at least based on anything that we have available right now. If at some point we do develop a drug, for example, that is completely curative against COVID or preventive against COVID, that would potentially change that. But right now, thank goodness we have these really, really safe and effective vaccines. But I don't anticipate that we will eradicate COVID for sure. And it's going to be more about bringing it under control. And I think, yes, if we have really good vaccine uptake and, we are seeing 3/4 of the population being vaccinated, I'm really confident that we're going to be in a place where it's not going to be impacting us at this broad scale. And so some of these really rosy projections for the summer are based on a presumption that we will continue to see vaccination uptake continue. So when President Biden talks about, the 4th of July and of being really confident, that is primarily based on an expectation that people will continue to want to get the vaccine. And this demand, it's hard to imagine right now that there are vaccine sort of sitting without people's arms for it to go into. But that actually is the case, it seems, in some other parts of Illinois. And we've seen folks doing some more driving downstate to access some of that vaccine. But I don't think we're that far from that here in Chicago, particularly if we see the supply ramp up like had been projected. That, I think by May, late May, we're going to be in a place where it's not going to be hard to get a vaccine, and it's going to be the much harder work of let's have second and third and fourth conversations with people who maybe were not first to raise their hand. We've got a lot of creative ideas about how to bring vaccine to people and to trusted settings. And once we get through this really big surge of people who are still really anxious to be able to get the vaccine, I think we've laid a lot of good groundwork here to keep vaccinating people, even perhaps where some demand in some other settings falls off. So we'll see. But as people get vaccinated, we will be broadly protected. But the true pandemic ending is also going to mean people around the world getting vaccinated, not just in the U.S. Question from Elena Levy. Could you get both the Moderna and J&J vaccines to be more protected against all the variants? And she's got a couple questions, but let's just take that one. So no, you should not get both the Moderna and the J&J vaccines to be protected against all the variants. The Moderna, the J&J, you get one. You do not need to get Moderna and Pfizer or Pfizer and J&J. You just need one vaccine, but to finish the series of that vaccine. And the protection, again, remains good against all of those variants, although slightly decreased against all of them. What would be probably recommended, it would be more like if we were really at a point where we had concerns about a new variant, there would probably be a completely separate booster that would be recommended. I don't think this is something that's going to happen very soon. We're not talking in a few months. We might be talking about never, but it would be more, my presumption there would be more like I got the Pfizer vaccine and Pfizer a year from now is making a sort of a booster dose that is against a newer variant. That's how I think it's more likely that it might happen, but that's a might. We might not need it at all, and but right now, no. Please do not try to get multiple doses of different manufacturers. We do keep track of everybody's vaccine records, and it's not needed, and it's not recommended. All right, Jude Kamler, what happens if you get COVID between your first and second vaccine dose? So if you get COVID between your first and second vaccine dose, you need to isolate just like you would if you got COVID not related to your vaccine dose. So if you get COVID, you need to stay home for the full minimum of 10 days and until your symptoms have resolved, assuming that you had symptoms. Once your symptoms have resolved, once you're totally feeling better and you're no longer infectious, you can go ahead and get that second dose. Marianne Mizal Hidalgo, any news about homeless getting J&J one-time vaccine? Yeah. So we actually, the people who are unstably housed and in shelters and even in some of the encampments already were prioritized actually very early in 1B, and we did a lot of bringing vaccine there. But yes, J&J is a perfect vaccine for people who are just less maybe connected to the system for whatever reason. So we like J&J a lot for people who are doing outreach to people who may be continuous riders on the L system or on the CTA system. We like J&J vaccine a lot for people who are, eventually when there's more of it, being discharged from the hospital. Anyone who's in the hospital, there is a standing order during flu season. A standing order means automatically everybody gets offered a flu vaccine at the time of hospital discharge. We'd like that to be available so that you could offer a one-dose Johnson & Johnson vaccine to everybody who's leaving the hospital, for example. We'd like to have it available in the emergency department. We know a lot of people seek care in the emergency department, but where they're not connected to a primary care provider, and the ability to have a one and done in that setting is also really important. And we like it a lot for workers, essential work settings, places where we're bringing vaccine. It cuts in half the logistics there, and it's very, it's very good for those settings. So yes, we are vaccinating. We've already vaccinated actually, like the huge majority of people that have been identified. We've been in all the shelters already related to homelessness. Eric Finkelstein on Facebook, how many people in Illinois have the variant? So our team tracks this every week, but it's not an answerable question because not every person who gets COVID gets tested for the variant. There are programs where certain percentages of them get taken aside for testing. We also, if we identify, for example, a breakthrough case or someone who has gotten COVID for a second time, where possible, we actually collect their samples and do some of that more advanced molecular testing, trying to see if variants are a piece of that. But we do track really, in Chicago and across Illinois where variants are detected. And here in Chicago, for example, there's been, something in the 30-something range of folks who have been detected who have had the variant. But that includes people who have had spread within Chicago, and then we know their contacts are not all tested necessarily for variant, but they likely have variant. And so as we are increasing, that does not represent the number of people who have variant. That reflects the number of people who were tested and had that more specialized molecular testing for variant. And you can go on the IDPH website if you want to see more of that details across Chicago. But there's also a lot of different variants, and so we track all of the different variants there as well. But we are seeing increases, and particularly in the areas of the city where we're seeing more spread. All right, last question. How can I have a safe Easter celebration? By not getting too excited too fast. Having the conversation with anyone who you're going to be gathering with that still, especially if there is anyone who is not fully vaccinated, the safest is still to not gather, is to do more of the remote. If you're attending religious services, if you yourself are not fully vaccinated, or you're at high risk for COVID, the recommendation would be to attend remotely. We are working with some of the religious groups around Chicago who have moved some of their services outside, which is certainly safer. And I would recommend, if you're going to be gathering, to do that outside where possible, and just keep those masks on where you can. Recognize that if you're taking the mask off to eat and you're with people who are not already in your bubble, that is a risk for transmission, particularly if you're not fully vaccinated. And really, I think recognizing that people are in different places related to their concern and risk factors about COVID. And, we are in a high risk setting, unfortunately, in terms of how much COVID we have here in Chicago. And so please be careful. Preference is not to gather. If you gather, please try to do it outside. Definitely keep the mask on, and be extra careful with anybody who's not fully vaccinated and or has underlying conditions or is older and is at high risk for those adverse outcomes. My biggest concern is those 18 to 29-year-olds and 30 to 39-year-olds, getting together for a celebration with people they don't normally see, who may be at higher risk than they themselves are, and seeing a lot of spread. You don't want your Easter celebration, to turn into a contact tracing event. You really don't, and we don't want to do that. We do it. We do a lot of work with families, even right now, who are gathering for all the things we love to gather for birthdays and neighborhood celebrations and, family gatherings. And there are, each day as more people get vaccinated, these things are becoming safer. But with the amount of people fully vaccinated, unless you've got a fully vaccinated group gathering, there still is a fair bit of risk. And that risk is going to go down, I promise. By this summer, I'm feeling really optimistic about larger events and what we're going to be able to do and where we're going to be, assuming vaccine supply increases, assuming people take it. But for right now, still, please do try to think of others, and especially those at more risk for the severe outcomes. If we can kind of ride this increased rate of cases without seeing a lot of impact on hospitalizations and deaths, we'll feel a lot more confident in terms of not needing to roll things back, which is the last thing that we want to do. But if we really have to, we would do it. So, try to, even if you're by yourself, try to get outside. It's going to be spring. I like to celebrate kind of spring at the same time that we're thinking about Easter and hope and all the things that come with Easter celebrations. There is real hope at this time, for sure. It's just sort of hope matched with some of the ongoing caution in the short term, and I know that's a hard message. All right, thank you all for tuning in. We will be back next Tuesday for additional questions. One just kind of good news piece is, as a reminder for people who are having still economic issues, and I know there's a lot of people, for people who are struggling with water utilities, for example, the city's utility billing relief program is working in partnership with CETA. For eligible Chicagoans, lower income, et cetera, you can get a 50% rate reduction and no shutoff penalties or debt collection on any City of Chicago utility bills while you're enrolled in the program. And anytime you enroll, if you've got a big past balance, we'll actually set it aside for forgiveness as long as you complete 1 year in the program. And there's a payment plan. The idea is to help folks. This last year has been really hard for people who have been out of work, have had their incomes disrupted. And one of the options are things like city bills, like city utility. And so please go to chicago.gov/UBR. That's for utility billing relief. And you can see if you're eligible and apply today right online. And it's, not everybody is eligible, but a lot of people who maybe have been hit hardest by COVID would be. And we're trying to use, where we're getting additional federal funding, trying to think about ways to, support a lot of the economic stressors that have come down on individual Chicagoans. So it's a good program because it's not just about moving forward, it's about looking at that past debt. So please check that out, or if you know people who've been struggling with utility bills, that's a really good place to start. And I think other than that, happy April Fool's Day. Don't be a fool today. Wear your mask, social distance, don't gather. It is opening day for baseball and for the Cubs, and I have every confidence in their plans for being at the stadium. It's a 20% capacity and everything is in place there. But a reminder that if you're celebrating baseball too, and not to let your guard down, as you're gathering and, enjoying being able to bring some of these things that we love back. Just my concern is more gatherings that are probably going to happen to watch that game or around that game, as opposed to what's in the actual stadium. So just, celebrate, but be careful. And if you're in that younger age group, know that that's where we are seeing COVID spread. And so be careful. And for those who do celebrate Easter or who celebrate Passover, happy celebrations of those and safe celebrations of those. We'll see you back next week. Thanks.